I really, I think from another point of view, when you talk about willingness to help, willingness to help from the kindness of your heart, we will always find people, wonderful, that will come through. But I think here's a matter of infrastructure and policy. I mean, we cannot be waiting for people to be motivated. I think that there have to be reforms that will assure that people have what they need to have. Because we cannot always do it as a charity thing, because then it depends on the time of the year. And no, we have to really reform the system that is not working, and it's going to work even less as we go. So there has to be something more profound that if you want to come, please.
But the more people that are involved personally, then I think you can move forward to that next step of making policy
Yeah,
changes.
because if not, people who have nothing and nothing to lose are going to start pushing for those changes.
Wow, we have lots of questions. Yes, ma'am.
Well, I'm a nursing student here, third semester, and I'm really encouraged and inspired to do something like this. But the reality of the situation, a lot of people at this level of schooling, they're going to come out $60,000 to $200,000 in debt. So and I've heard this talked about before, I never see it pan out, of some sort of ability to give back when you're finished with school, with some, then at the other end being helped this incredible debt load. What do you think about that?
There's a lot of programs that have debt repayment with them. I'm blanking on the name of it.
National Service Corps.
National Service
That's-
Corps,
that-
yeah. And you can even apply to get stipends while you're in school
Really?
if you make a commitment to a couple of years in serving in an underserved area. So there are things like that in place, so look into it.
The gentleman in the brown sweater.
This is a question for Ms. Crawford. The $9+ million grant that you just received for the Family Health Center, which is a great part of our community here. How many more people are going to be able to touch with that? We're touching 20,000 now.
We anticipate approximately at least an additional 20 to 25,000 more.
So it doesn't even get us all the way to the 60.
Correct. So it doesn't get us to the 60, but it gets us much better. So we're thinking about 45. And a lot of that will depend on our ability to recruit physicians. Currently, we have a staff of about 20 FTEs, and it's for the entire community. Primary care is at a premium, so getting individuals that are willing to come and work in underserved populations, there are some, but a lot of it will depend upon that. One of the things that we're doing, and I don't want to take up too much time, but one of the main focuses of that entire grant is that obviously we're building, so we'll grow about 200% in size in order to accommodate this population. But we're trying to think very visionary as to how are we going to get on top of this. And so we're doing a wonderful collaboration with KCMS Family Practice Residency Program. And so a portion of the Family Practice Residency will actually be housed, so not just rotate through the Family Health Center, they will be housed and that will be their permanent home. And so the thought is that we'll be able to get these family practice residents where they'll have an excellent experience. They'll be able to work in a new state-of-the-art facility and most importantly, be able to affect the care of the patients and definitely impact that. So stay tuned, October 2012, and it'll be 104 exam rooms. So we're getting up to do great things.
Young lady in the black, please.
I'm just wondering, and not being from Kalamazoo in particular, what makes Kalamazoo and even Michigan as a state sort of a higher rate of all of these incidences than other communities? And with a lot of people going out of the country and different things to help, are they just not aware of what's going on like right here in Michigan? Or, I mean, I'm just kind of curious what's the thread, I guess, that makes this particular town more susceptible to these higher rates and things like that. Demographic,
I mean, I'll just basically say, outside of infant mortality, actually Kalamazoo is pretty insulated. We do quite well in comparison to other communities. I think it's just the state of our current country. And I think many people do not know there's so much of the haves versus the have-nots. that we're just not aware of it. I mean, we would never know, most people don't realize 60,000 people do not in our community. But we're far, far better, quite honestly, than even, a Wayne County. Detroit is completely different, the east side of the state. Actually, Kalamazoo does quite well. We capture ours quite well in comparison.
Do you have a question in the back?
Yeah, sort of, or comment. I think it needs to be approached both politically from systems and also personally, but I'm wondering, even when you sent the letters out, anybody can ignore a letter and think that someone else will do it, but I wonder if it would be worth trying contacting doctors personally, one-on-one. I have this patient that needs this, would you take this one person? And just sort of opening the door that way, and then maybe after that, could build on that. I don't know.
And we have done, I think you have to be careful with that, just in the time commitment of doctors and availability, but there are times when our providers who have relationships, obviously, with the provider community, and so they definitely use those. If they have a patient that they're really trying to get through to gastro, then to make a personal call or make a personal stop, but if you're seeing as a provider 35, 40 people a day, you can only do so much of that. From our standpoint, from the center standpoint, on the referral piece, meaning patients that go out to specialists, we average about 6,000 to 7,000 patients a month. And of those 7,000, about 1,000 are referred out to specialists, to various specialists. So it's pretty vast. But there is some of that takes place.
I think we have time for one more. Yes, ma'am. I know you wanted one more shot.
This is directed to Dr. Walker. I was wondering, in your going to different countries, if you have noticed a difference in different cultures' viewpoint on the intrinsic value of life, how they view life as every life has value, versus our society in the United States, where it's very easy to be the haves and have-nots, and think of the have-nots as maybe deserving their lot, or having made poor choices to be where they are. And if you see something different in other countries.
That specifically is a little bit difficult for me to address. What I have noticed when I'm going around is most of the people in the various countries I've been to, when they can get any kind of medical care, they are so appreciative. If you can go and if you can give somebody that has chronic rheumatoid arthritis, if some of these patients can just get Tylenol or Motrin, or if they can get a 3-month supply of that so their pain goes down, they're just so appreciative because they don't have anything. So, and it's incredibly rewarding to reach out and meet those needs of those people. As a provider, I don't get much patient contact here, but as a provider, you really do feel appreciated when you go to those other settings, and oftentimes you don't get that here. There's this expectation of the very best quality medical care, and I sort of deserve it. I've got the money. I want this test. I want this CT scan. What do you mean I have to wait a week to get this scan done? I want it done tomorrow, and our expectations and our demands are oftentimes very skewed. As a pathologist, we're looking at biopsies that are coming into us, and the expectation now from most of the docs that send us specimens is they want the report back in their hand the next day, because patients are expecting the diagnosis the next day, and it's really messed up compared to what it should be.
Thank you, Bill, for that closing comment. We do need to adjourn. Thank you very much for coming, and my thanks to this wonderful panel. It's been a very There's a great deal of food in the atrium. Please help us.